Hi everyone, welcome back to another live event. I am Rachel Altum, the online community manager for the Gypsy Nurse, and today we have the pleasure of having AMN Healthcare join us. It's been a long couple of years for nurses and others in healthcare, and what we what will a new year bring? As I awkwardly say that, experts predict that more nurses will be traveling, innovating, and becoming entrepreneurs, among other trends in 2022. AMN Healthcare is here to discuss the 10 key nursing trends in 2022. Joining us, we have Sandra, Josh, Robbie, Nancy, and Stephanie. Thank you guys so much for joining us. It's been a little while.
We're excited to be back, and we love being asked to come back on Gypsy Nurse Live. So thanks, Rachel.
Thank you. Well, I will leave it to you to lead the way.
Perfect. Well, my name is Sandra. As Rachel said there, I am a senior director at AMN Healthcare, and I have the pleasure of having some wonderful recruiters with me today to talk about the top trends in 2022. Oh my gosh, that's a lot. What a day, right? Tuesday, 22nd February 2022. It's a lot for us to handle, right, Rachel? But I will go ahead and have the team introduce themselves before we get started. We'll kick it off with you, Josh.
Hello, my name is Josh Snow. I'm a senior recruiter here at AMN. I've been here about 6 years, and a fun fact about myself is I also produce music on the side.
I love it. I don't think I knew that about you, Josh, so that's cool. We'll have to hear some tunes. Robbie, let's go over to you.
Hi, superheroes. Robbie Rose. I am one of the senior recruiters here at AMN. Fun fact about me: I love playing golf. I get as many holes in it every week that I can, and I have a new son on the way. He will be born in about seven weeks. So,
Oh, congratulations, Robbie. I love it. Steph, let's go over to you.
My name is Stephanie Markham, and I'm associate recruiter here with AMN. I've been here for about 8 months. And fun fact, I was actually an ICU travel nurse prior to this, so I've been in both worlds.
And I know the group is so excited to hear from you. I am sure I get your input. So nice to have you too, Steph. Nancy, let's finish up with you.
Hi, I'm Nancy. I'm a manager of recruitment here, and I've been here for about 3.5 years. Fun fact that probably surprises a lot of people is that I was actually born in a different country.
So interesting. Which country was that, Nancy?
I was born in Honduras, which is my
cool.
ethnicity, but yes.
Yeah, I love it. I don't think I knew that either. So I'm learning things as we're going too. Well, welcome, guys. We're so happy to have this panel. We're so excited to get started. I know Steve Curtin's already in the chat, looking forward to it. We are too. We've got a great list of trends that we're going to talk about. But as you know, I can never start one of these. If you've ever watched our Gypsy Nurse Lives before, you know I can't start these conversations without first just saying thank you. A huge, huge, huge thank you to all of our clinicians out there, whether you travel with us or not. 2020, 2021, moving into 2022, it's been a couple of crazy years, and we know that you have just been working so hard, working a ton of hours as we transition out of this pandemic into more of an endemic. You're continuing to work hard, and we just appreciate everything that you do. So can't start without saying thank you. With that, you also know, if you've watched us before, that we love to give away prizes, and we've got all kinds of fantastic giveaways for you. So we are going to start with our first giveaway. This one's really easy. The first 5 questions that I get in the chat, we'll be sending you a prize, and it's a good one. So keeping in trend or in line with our traveling around the country and all of the amazing places you're going to go, we want to give you things that will help you with that. So we do have a white noise machine and also an Apple AirTags to help you with anything that you think you might lose, which, you know, I lose things all the time. So first 5 questions in the chat, we'll get those prizes. And while we wait for those, let's go ahead and kick us off, Robbie. I know that you were going to talk to us about one of the big trends that we're seeing and have started to see over the past couple of years, which is this idea of utilizing self-service. So clinicians being able to help themselves.
right, yes, and just to say, it's a pleasure being here. I've never been on one of these before, so it's just a pleasure and honor being on here with all of you fabulous people. So thanks for having us. And yes, you know, the most important trend here really at AMN to me, and I know to a lot of us on the call, is self-care. excuse me, taking care of yourself, your well-being, and your health is number one. Also for us as well, and the patients and the communities we serve. But it starts with you, the clinician, right? So we have developed tools now that you can. It's called the AMN Passport app that we developed in 2020, so 2 years ago. You can download it to your smart device, and that gives you, the clinician, the flexibility, the autonomy to be able to search through all the jobs that may be of interest to you. It's the same exact screen that I can look at if you had me on the phone, right? So really it's that piece of technology that ties in with the human element as your recruiter. Once I see that interest come through, or you show interest in a job, I should say, we can get your resume, we can have it sent over to the facility in a timely manner. And, as more of your career advisor is what we really consider ourselves. We can do all the back end work, right? We can bring you in the best light so that we can get you that offer at that, ideal travel assignment.
Yeah, which is so cool because it's almost, I kind of joked with this group and I'll joke on here too, but it's almost like my favorite pastime is looking at the Redfin or Zillow app and seeing all of the houses that
Yeah.
are out there that I could potentially go to. But if I get really serious about something, then I have that real estate agent or somebody to help support me with the actual process of it. So I know, Robbie, you had kind of a fun story about actually one of your own nurses that utilized the AMN Passport app to help go to her dream location.
Yes. We have been trying to get her a job at Mass General Brigham, which is probably the biggest healthcare system within the state of Massachusetts. We have exclusivity with that healthcare facility and healthcare system. Excuse me. You'll hear a lot of that word on this call, but she really did all of the work. She got off her night shift. She went onto the app. The job was her ideal job was finally open. She showed interest. I had her profile and the resume ready, did the back end, and within 24 hours, we had an offer and her booked, and now she's at Mass Gen and happy. So it really just shows that technology part, right, Sandra?
Yeah.
And with the human element, right? She really needed, when I got into work, for me to make sure everything was in proper order for us to get that timely offer.
Yeah, totally. I love it. And it just creates such great partnership that we can help
Correct.
you. You can jump in there to help, to help yourself as well. So we do have our first 5 questions, which I'm super thrilled about. Life
All right.
Rerouted said, what is your favorite place to visit? Robbie, since you're unmuted already, what's your favorite place to visit?
Anywhere where there's a beach. I love the beach. We have a family vacation every year in Santa Cruz, California, which is in Northern California. If you're not familiar with the location, it's really close to Monterey and like the Central Coast, south of San Francisco. But anywhere that has a beach and sand where I can, be there with my family.
I love it. And we've got a ton of those locations. So reach out to your recruiter, jump up on that AMN Passport app. You'll be able to find them. But we do have a ton of beach areas. And if you're not a beach fan, I'm sure we can find you something else too. What's the best place to travel so far in 2022? So Josh, what do you think the best place to travel to, or where's the best place to travel to so far in 2022?
Right now, I would say probably California. I mean, it's been super beautiful over there. Obviously, all the jobs that we've had there have been paying the most, considering if that's something that you're looking for. And it has been relatively easy to get the license due to
Yeah.
the EMSR. So
Yeah. And as we were all talking about before we went live, it's cold everywhere else. So come to California and get out of the cold weather.
yes, for
We can
sure.
definitely help you with that. Stephanie Lynn, I love this. You're excited for this. We're excited too. It is not too late to start traveling. There has never been a better time to start. And I'm sure every single one of these recruiters on this call would love to connect with you and find the best place to go. Crystal Watson asked, what is the best way to prepare for an assignment? Stephanie, I'm actually going to give you this question since you have it on both ends, but what's the best way to prepare?
So honestly, when I was looking at travel contracts, there was so much out there, and I think I honestly just did research. Like I looked on the Travel Nurse Gypsy Facebook group and kind of got an idea and feel for hospitals and different systems, and I just really did research on, cost of living because I wanted to make sure to maximize what I was going to be making too. But also too, just think of somewhere where you want to go that you would want like an extended vacation, and find a place that you, or if you travel with anybody, would enjoy being able to kind of become part of the culture for 8 to 13 weeks, and then just start there. I would say too, also check into kitchen supplies because that's a lot of things I ran into with Airbnbs, is making
Oh
sure you
yeah,
had the proper kitchen supplies and just packing and making a list of the things that you like can't live without for 13 weeks.
totally. So you packed your air fryer, right, Steph?
I have an Instapot, which you can cook on it like a stove, and that was a lifesaver.
I love it. And you can make so many things in an Instapot. So great. And then the other question that we got was from Ashley Meyer is, what is the new per diem rules for contracted days off? So we did recently have an enhancement to our per diem rules, which have been a huge benefit to our clinicians. So what we saw is that a lot of clinicians were, maybe calling out sick, or had, mental health days that they needed to take. And previously, we actually weren't supplying per diems to our clinicians because they weren't able to work at the facility. So we weren't billing the hospital and doing all of that on the back end. So we were not paying out per diems. We've just actually changed that to now a clinician will get paid if they have to call out for sickness, mental health reasons. We really want to support you and make sure that you're getting what you need to be taken care of. Where a change came in is that if there are contracted days off in your contract, so you have to have specific time off days, you do receive a proration for those days of time off. Since you're not able to work at the facility, you're not incurring that cost on behalf of AMN. So a little bit of a change there to benefit our clinicians in a different way. But if you have additional questions, feel free to reach out to your recruiter too. They're more than happy and have all of the info that you need to help answer the questions. Gosh, we have so much in the chat, which is so exciting. Nancy, you actually got a shout out from Ashley Meyer saying it's nice to put a face to the name. So hello. And one other question I'll just ask, maybe Nancy, I'll ask you. Alice Ng said, what makes AMN stand out as a company?
Honestly, there's a lot. I think the one main thing that helps us stand out is the relationships that we've built with a lot of our clinicians, and the support that we offer. We also have, I think, the most exclusive job opportunities that are available out there. But the main thing for me that really stands out for me are the relationships that we're able to build with our clinicians. I know most of my travelers, if they're on here, they know me personally. I've gotten to know them so well over the years, and I think that really sets us aside. You're not just a number to us. You're our peers, our friends, the people we work with, the people we spend most of our time with. So I think that's the main difference for us.
I love it. Yeah. And we really are. You saw all of the recruiters on here nodding. We're really helping each other achieve our personal and professional goals, which is really cool. And it's a totally unique thing. So lots of great shout outs. We have some of our AMN team members on the call. So hello, thanks for supporting us. I know some of these guys were a little bit nervous. I know I always get a little bit nervous. And we have some of our respiratory therapists, travelers with us. So hello, shout out to our allied team members too. Well, we'll keep progressing. There's so much going on, guys. But Robbie, I know one of the other things that you wanted to talk about was how we're getting back to this feeling of traveling for adventure, right? Money is definitely the thing. It's an important part of it. And there's a lot of money to be had, which Stephanie will talk about a little bit later on. But talk to us a little bit about that adventure piece.
Of course, right? Money is obviously number one with a lot of us, but really it's getting back to the fun of travel nursing, right? It's one of the main reasons I wanted to be a recruiter is because I could live vicariously through some of these clinicians that I work with, and the ones that go to Hawaii or go to these locations that I could think right now of 10 places I'd want to go if I was a travel nurse, and I would be working with my recruiter to line that up. You can go there for 13 weeks. You may even be able to go there for longer. I've had clinicians that will go there for multiple extensions, right? So it's definitely available. It's definitely something to think about. And depending on where you're licensed and what state you're licensed in, you could definitely turn it into your dream travel job. You don't work every single day while you're there, so you definitely can enjoy it as a vacation while you're not working.
Right, totally. You have that flexibility, which I know you hit on a little bit there too, Robbie.
Right.
You hit a little bit too on another big thing that we're seeing, which is extensions. So
Mhm.
we have actually, for all of you to know, we have a historic number of clinicians who are coming off of their assignment in March and April across the entire travel nurse kind of landscape. So if you haven't rebooked your assignment yet, be sure that you connect with your clinician or with your recruiter after this call. But Robbie, we also like to have fun with some of these things. So you have another example of a clinician who's really excited about our current giveaway.
Right. It's again one of the best things about this company. It really is, you guys. It's she was entered into this recent promotion because she did extend, and it was for the Apple Watch. I have an Apple Watch. They are amazing. You know, she was so excited. She went as far as texting me what color she wanted. So we got her down for the rose gold, Sandra. So if she gets picked, we're gonna have to send her the
We
rose
got to
gold
send a rose gold one. I think
Apple.
we let
Yep, Apple
marketing know
Watch.
about that. So we've
All
got a
right.
rose gold one set aside for her. I
Perfect.
love it, Robbie. So yeah, just the adventure, that fun, flexibility, some of these key trends that you're really hearing, and being able to have that self-service element to help support yourself when you need it.
Yeah.
So with that, I'll kind of continue us on here. We have some other really great questions. Before I go into questions, though, we have another giveaway. Our next giveaway will be for 10 winners. All you have to do is jump onto TikTok. I'm actually embarrassed to say that I had not had TikTok and had to do it in the last couple of weeks. And now I've gone through the TikTok spiral and I'm obsessed. So I'm sorry in advance for wasting your time. But if you jump onto TikTok, find us, username at AMN Nurse. The top will have 10 winners for a water bottle, luggage tags, wireless chargers, and a travel journal. So a little packet that you'll get. We'll do just randomly pick 10. So jump onto TikTok, follow us at AMN Nurse, and we will get in touch with those prizes. So a couple more questions that came up in the chat from Vanessa. Do you support Canadian nurses? Yes, we are actually seeing a large influx of Canadian nurses right now, which is fantastic. And we have a process in place to help. If any of you listen to our earnings call, we are a publicly traded company. Actually, Susan Salka, our CEO, talked a little bit about Canadian nurses and bringing clinicians in from outside of the US. So we absolutely help support Canadian nurses. Great question. What do you think travel nursing will look like in the next 5 years? What do you think travel nursing is going to look like in the next 5 years? Nancy, do you think you can answer it?
I had a feeling. I had a feeling it was going to be me. Honestly, I'm in the next 5 years, I think it's going to kind of stabilize, kind of back to how it was pre-COVID. I think we're still going to be seeing a lot more nurses traveling. You know, before COVID, not as many were leaving their perm jobs to travel, but I think once they've felt that travel bug, even regardless of the money, once you get that travel bug, you're still going to want to do it. And I think it's going to kind of go towards that, more towards going to locations that you're actually interested in, while still being able to make the money that you're trying to look for. But as far as rates, they're most likely going to go back to standard. We do have seasons, random seasons, you know, like the winter season, so like flu seasons. So you know, rates will go crazy with those, mother babies. But I feel like in the next 5 years, it's we're still going to have those trends, but the rates are going to go back to standard how they were before COVID, and nurses are going to still travel, but also travel more for for different locations.
Hopefully more for the
fun.
adventure, right?
Yes,
Yeah, for the fun of it. So we kind of expect maybe a little bit of normalization. We'll talk a little bit about that just as a trend of 2022. But what you all know is that nursing is in high demand. So we don't anticipate that there is going to be a lack of needs for travelers, which Nancy just talked about there. So another question we had was, considering the downtrend of COVID cases, do you see travel tech openings less through the summer? Not really. I think kind of what Nancy was saying, I think we'll continue to have a lot of opportunities available. Overall, there's still need in the healthcare industry, so lots of positions. And then Crystal, so ready to travel. She'll definitely keep researching. So Steph, sounds like you helped Crystal with her question, which is great. And I think we'll continue going. There's a lot of great stuff going on. So keep throwing your questions in the chat. I promise we will answer all of them. Josh, you are going to continue with the trends. And one of the things that just came up were those tech positions because of COVID cases and that sort of thing. But talk to us a little bit about impacting communities, and that's how that's going to continue forward.
Yeah, absolutely. So at the start of at the start of the pandemic, we really saw clinicians jumping into hotspots like New York, which was the first area to really see the COVID outbreak. My wife, who is also an RN, she wanted to get out there and help as well, even though she had been away from bedside for about 5 years. So, unfortunately, she wasn't able to go, but she wanted to.
Yeah.
We also supported the FEMA vaccination and other vaccination projects, which led to the core values of our nurses, which is to make an impact just by going to locations in need so they can support the new community. We have a lot of exclusive relationships who we consider our partners. When there's a big need, we hear about it first and can direct our clinicians to where they can make the greatest impact.
Yeah.
So during this time, we could help them strategize contracts in order to take care of themselves and their patients at the same time.
Yeah, which is so huge. And Nancy talked about it a little bit too. We do have seasons in travel nursing. So we will see spikes in the wintertime for our ICU and all of the step downs because of flu season, just generally. Obviously, the past couple of years, it's been a spike due to COVID. So we don't anticipate that's really going to go anywhere. But we also have spikes during the summer months for maternal child health. So we have a big need for labor and delivery nurses or postpartum or NICU nurses. Kind of a fun fact I like to throw in here is that actually when I had my son 18 months ago now, which seems like forever. So any of you moms out there, you feel my pain. But one of my nurses who helped took care of us was actually an AMN traveler. So it's just a full circle, really helps you see the impact that we do make and that all of you make. And you really are supporting communities and supporting the people who live there. So again, shout out to just how amazing you are. With that, Josh, I know you were also going to talk a little bit about just the changes in the market that occur kind of naturally, but what we're also seeing right now.
Yeah, absolutely. So, let's talk about local travel. We have heard people are wanting to stay a little closer to home because they're just either tired or tired of working in constant overtime. So obviously, you need a mental break. There's definitely a lot of local assignments, and lots of new travelers that are looking to stay a little close to home to get their feet wet and to see if traveling will be something for them in the future, which also ties back to impacting their communities just in a different area that they are familiar with, while at the same time being driving distance from home.
Yeah.
We're here to help. Oh, go ahead.
Go ahead. No, go ahead, Josh.
Yeah, we're here to help you and get to know who you are so we can support you and be there for you while you're putting yourself on the front line.
Yeah, and that's such a huge thing, right? Just really, it goes back to what Robbie was talking about with being career advisor and helping with that partnership. And we really want to help wherever it is that your focus is. I know Stephanie's going to talk in just a little bit about that kind of burnout and just that self-care piece a little bit more. But the other thing I think with getting to know our clinicians too, Josh, right, is being able to help them with those questions
Yes.
like licensing. And it was actually a question that came up. Does AMN offer any help with getting licensed in another state? So short answer is yes, but Josh, do you want to hit a little bit more on that and then talk about licensing currently as a trend?
Yeah, so we definitely can help you get licensed in another state. And yes, you can apply to a job if you do not have the license. It just really depends on the need of the hospital if they're willing to wait for you to get that license. A lot of times we do have a licensing team that can jump in and help you get licensed. We just have to have you booked into a specific job that's willing to wait for that license to post. But on the other end, there's also a lot of states that offer temporary licenses. And like right now, there is a lot of crisis licensure areas. So it's really never been easier to travel to a new place, especially right now, just due to like the MSR licenses and whatnot. We do expect, though, over the next year that many of those crisis licenses will go away. Like California, they are doing away with theirs on March 31st. But don't let that scare you, because California did just start the process for compact licensure. So that will be amazing once that finally hits, just because it'll make it that much easier to go to California instead of having to wait, like, what is it, 10 months to get a license?
I know.
So yeah, and
I
there's
just,
also 34 other states that are compact license ready. So it's a lot of areas that you can go to.
yeah, I love it. And lots of places to travel. Travel while you can for sure. And we can help you every step of the way. So thanks for all of that, Josh.
Mhm.
It looks like we do still have 3 more spots for our TikTok giveaway. So jump in there. Make sure that you follow us on TikTok. I'm sorry if I'm making you download it, but I promise it'll be worth it. We've got some great content in there. So Josh hit a little bit, Nancy, on just the crisis license piece. Coming out of that, we're expecting to, which is exciting because it means that we're all starting to get a little bit healthier, hopefully. But we're expecting that we're going to kind of continue to come out of this pandemic state. You want to talk to us a little bit more about that?
Yeah. So I mean, we've been dealing with COVID for the past couple of years, and like Josh mentioned, we are expecting to see the crisis licensures go away, but we're not expecting to see COVID just completely go away as quickly as those are going away. As a company, we've been thrown a lot of curveballs, just kind of with COVID, trying to figure out how to deal with different situations, and we've been able to adjust ourselves and kind of work with our clinicians through the different changes. Um, but I feel like with all of those changes, I feel like the one thing that has really stayed consistent with us is that our number one priority is always making sure that our clinicians are safe and their well-being, of course. And I think throughout COVID, we've really done a really good job of showing them that's our truth, that we really do care about their safety and well-being when they are traveling under us. I know
Yeah.
there's we've done one. There's a few examples I'll call out too, I guess, but there's one when our clinicians get COVID on assignment. We once they report it to us, because that's kind of our process, they have to let us know. But as soon as we find out that they have COVID and they received it on assignment, we actually send them a cute little care package that they receive. So it kind of gives them a little virtual hug from the company, just letting them know that we care. And it's not something that we have to do. It's honestly something that we as a company really want to do, just to show them like we're here for you. We're in it. We're in it together. We want to show the support and we want to make sure that you know that we are here to support you through this hard time. Um, I know the second little call out is that as recruiters, I know specifically for me, and I know a lot of other recruiters do it, is calling my clinicians. If I know that one of my travelers has COVID, I'm reaching out. I'm trying to call, most likely texting, because I know they probably don't want to be bothered if they're feeling a little crappy, but I'm making sure that they respond to me, letting me know that they're okay. And this is genuinely because I care about them. Like they're under me.
Yeah.
I've built relationships with every single one of them, and I need to make sure that they're okay, to make sure that they're surviving whatever they're going through. And again, letting them know that I'm here with them. I'm here to support them as their recruiter and as I guess their main point of contact through this whole situation. So
Yeah.
those two are really great for us.
And huge. And you saw all of the nodding heads. And I'm sure for any of our AMN team members or recruiters that are listening, they're probably all nodding their heads as well. Is that your safety and well-being is huge. It's a big part of what really drives us, and is one of our kind of pillars as far as being able to support our clinicians, make sure you're okay, helping with that COVID pay, making sure that you can pay your bills, helping you with just things like sending a soup basket, like Nancy said, so that you don't have to worry about eating, which is always my issue, right? I don't know what I want to make for dinner. I don't feel like I can make anything for dinner. Being able to take care of yourself, your family is critical and a huge part of what we do. Just a couple of quick little shout outs. There's lots of great info, and we're loving this. So thank you guys. I do want to go back to just a couple of quick questions. So Brittany asked, I have a compact state license, but can I apply to a job that is not included? So hopefully we answered that from Josh. Yes, you can. You can definitely travel to really anywhere. There's temporary license for really all of the states. You can get a temp license, and then we'll just set your start date so it's far enough out so that you have that license prior to start. Are we seeing a need for medical and or disability case management? We definitely have some needs for case management. I kind of have to defer to recruiters on how much they're seeing. Robbie, what are your thoughts on case management jobs?
Yeah, I'm seeing an influx, excuse me, in the California area. I do have one nurse that does work at the Moreno Valley Kaiser on case management, and they've actually asked her to move to night shift, which is uncommon for case management. It's usually a day shift position, right? Monday through Friday. So there is an influx, especially in the Southern California area. As far as if it's more for medical and or disability case management, I do apologize. I don't have that information
Yeah.
at this time, but
No worries. Most of ours would probably be medical, but definitely reach out to your recruiter. Check out also, I'll kind of plug the AMN Passport app that Robbie was talking about before. You can see all of the jobs that we have available. So if you're not quite ready to talk to a recruiter or spend a lot of time in a conversation, but you are curious as to what's out there, jump onto that AMN Passport app and see what's out there. So Rebecca asked about psych NPs. We actually don't travel nurse practitioners. We do have psych RN positions, but we'd have to reach out to one of our other divisions to see about nurse practitioners in particular. But it is definitely an increase on our psych RN side. So there's definitely opportunity there. Another question here, do you think a nurse would ever be a good candidate to transition to remote recruiter or clinical liaison? Asking for my future self. Well, I think Stephanie will answer that question for us. But Steph, as she said, was a travel RN, and we do have those wonderful clinical liaisons as well. So Steph, good transition?
I love it. I love to be able to build relationships with my nurses and kind of stay connected to that world.
So hopefully that answers for you, Ashley. Nancy, I think you were going to continue on for us, talking a little bit. I mean, we're seeing it right now with all these questions in the chat, which is awesome. But there is a lot of information out there. In 2022, what we're also seeing is a lot in regards to specifically vaccine mandates. What do I have to have one? Where do I have to have one? Which version of it do I have to have? So how are we helping our clinicians decipher all of that?
Yeah, it's constantly changing. Us as a company too, we take a neutral stance. We're Switzerland. We're not ever going to force you to get a vaccine. We support whatever decision you decide to make. But we definitely try to make ourselves the experts on which facility, what state, or are requiring specific vaccines. We have a team that does our research and kind of keeps all of us informed. I think we're getting at least one email a day or at least a week with new updates on who's requiring what. And all the information that we also get is available online for everyone to look at. It's on our COVID website, which is coronavirus.amnhealthcare.com. And it's not just for our travelers. So anyone who's watching who isn't with American Mobile, you're still more than welcome to look at that website and just look at all the information that we have available. But so like I mentioned before, we make ourselves the experts and then we relay that information to our clinicians, and we're able to filter it just, to make sure that we're giving the clinicians information that is important to them, based on the facility or the location that they're going to, just so that, they can focus on their patient care instead of having to deal with knowing what mandates are up at their facilities or the states that they're in. So we kind of do their dirty work, I guess you can say. And
we do all the back end work, right? So we want to make sure that you know what's going on, and we want to remain very neutral as far as any what our stance is. But we like for you to know which facilities you can travel to based on whatever your decision is. So we are definitely here for you to help decipher all of that information. And I think maybe our marketing team can drop that coronavirus.amn healthcare site into the chat. Whether you're traveling with us or not, you have access to all that information. And we just want you to be aware of what the current mandates are and how we can help support you. So thanks for all of that, Nancy. So much information. All right, so I have another giveaway, but this one's really just a plug to a giveaway that's been already happening. So we are randomly going to select 3 users who commented on our Instagram promotion. So if you go to our Instagram page at AMN Nurse, there is a post for a giveaway. All you have to do is jump on there, comment, maybe tag a friend, and you will be entered into the raffle at the end here. You do have to be present to win, so don't jump off right away. We will ask you, you will win a prize with everything that is on that promo. So I know there's a Kindle with a case, there's all kinds of good stuff. So make sure you go check it out, and we'll announce those winners at the end of our little live here. All right, so Stephanie, I know that this group is probably very excited to hear from you, knowing that you have been in their shoes and now you've kind of gone to the other side and can see things from a little bit of a different perspective. But one of the things that Rachel actually mentioned at the beginning is nurses wanting to become more entrepreneurs, stepping away from bedside, being a little bit burnt out. Talk to us a little bit about one of the other trends, which is that financial goals piece.
Yeah, I think with 2020 through, currently in the COVID crisis and everything that's occurred, people have definitely gotten burnt out from being at bedside, and they've started asking themselves, like, where do I see my future? And so I think with the travel market and stuff the way that it is now, there's opportunity to make so much more money to be able to meet those goals. For me personally, during the start of COVID, my husband had lost his job, and at that time we needed two incomes, and we sat down and we were like, okay, what are we going to do? And travel is one thing we always kind of had in the back of our mind, but like it never aligned to where it felt like a good time to travel with two kids and, a family. And so we started looking into it and researching and found out it was very possible. And so just being able to travel, it like tripled or quadrupled my income, and it was able to replace that. So whether it's a short-term goal of just being able to replace income, or whether it's something like, paying off student loans or going back to school to advance your degree so that you can get away from bedside eventually. You can use, the money that you make from travel for that. Or I've talked to travelers, they're getting ready to have their first kid or buy a new house, or maybe they want to adopt. And one good thing about AMN is we have our employment assistance program, and they help with legal and financial advice. So if you don't even know what steps to take, you can reach out to them and kind of talk through, that step about what do I do and where do I put my money. Another big thing that I saw, like in the last year of when I was traveling too, is nurses are investing and becoming entrepreneurs, or getting into real estate or cryptocurrency and stuff like that. So it's just really, with the rates how they have been and what they currently still are, it's a really great opportunity to meet those financial goals.
Yeah, I love that. And a question that we had gotten earlier on was, why aren't recruiters more educated on tax laws for travelers? And I think everybody on this is like, oh my gosh, you do not want me to be the tax expert. But what's great about the EAP is we do have tax professionals that you can talk to. They're a little bit more well-versed in travel tax law. So you can actually talk to someone, which Stephanie, I'm sure from experience, it can be confusing, and you want to make sure that you really have someone who understands that kind of very vague tax law when it comes to
Yeah,
that sort of
definitely. I'm
thing.
not a tax professional at all, so please don't ask me.
Exactly. And we will direct you
It's a
to the
lot of
right people.
information. Yes.
There is a lot of information. It's all really vague too. So lots and lots and lots of information out there, but we're happy to help guide you in the right way. So kind of staying on this topic of pay, something that's exciting for us really, because it means we're all kind of getting back to this more healthy state, is we are starting to see normalization, and we'll expect to see normalization of rates as we continue on in this year. And as Nancy mentioned, hopefully, and probably over the next 5 years. So talk to us a little bit about that stuff.
Yeah, so I think for nurses that did start traveling during COVID, they were seeing the $5,000, $10,000 a week, and these just outrageous, like it was amazing, the money that was out there. And a lot of questions that I get is, why are the rates going down? Why is this occurring? And it's, typically what it goes to was pre-pandemic, was it starting to come and kind of normalize to what it was, but it's still higher than what it was pre-pandemic. So it's a really good opportunity to get involved with travel now and try to maximize and make the most amount of money that you can. It's good because people are getting, healthier, and COVID is slowing down somewhat. But nurses are also burnt out, and so they definitely want to feel valued and they want to get paid for what they deserve. And so I just think that, travel nursing, you still make at least double, triple what you're making as staff nurse. So it's still a good opportunity, even if it does normalize and go back to pre-pandemic rates.
Definitely. Still a lot of money to be made. So not
Yes.
too late, definitely to jump in. But now, as kind of Robbie talked about before, we can get back to some of those really fun things of traveling for adventure, making the money, yes, of course, but having those experiences, which Stephanie, you talked about with you guys going on the road, is
Mhm.
probably things that you'll look back on being able to do with your family that probably wouldn't have otherwise. Um, so the other big question, I know I get asked this question a lot, Stephanie. I know you probably as a traveler ask this question, and you get asked it as a recruiter, but it's around this element of transparency,
Mhm.
and how that is really a trend, and should be a trend. But talk to us about transparency when it comes to traveling.
Yeah, so I think as a nurse, nurses love to educate and they like to be educated so they have more information. And I think transparency is huge, and communication with your recruiter is key because, I have one of the most common questions is, why are you offering this pay when this other company is offering this? And there's a lot of confusion about how pay packages are built and stuff. One big thing to consider is it's not just the hourly pay, it also has to do with reimbursements or the EAP program and being able to really support our clinicians, like when they get COVID, send those care packages. And so I think it's really important that, if you ever have any concerns about your pay or questions, just reach out to your recruiter and don't be scared to ask, because our number one goal is to really make sure that you get the vast majority of the rates because you're out there doing the hard work. And I can speak as a previous travel nurse coming into this role, there was so much information that I did not know about the pay packages and how it was managed. I had just heard what was the misinformation and stuff that was out there. And I can honestly say that AMN from the CEO down loves the nurses and wants to make sure that they're getting what they deserve.
100%. And it really is a core value of ours to make sure that we're helping support our clinicians from all elements, right? From the pay
Mhm.
package side, but also, as you talked about, from that emotional, mental side is huge, huge, huge for us too. One of the questions that we got here, which I'm going to ask, is if a contract is causing mental health concerns, can I cancel without being blacklisted? So the great thing about working with AMN is that, as Stephanie mentioned, before it gets to this point where you're feeling like I just can't even handle the situation, you have the transparency on our end with talking to your recruiter. We also have clinical liaison or clinical managers for every facility that we have, so that you can talk to that person who is clinical. They know your world, all the things that you're talking about, so that maybe you can work through it. But if it really just isn't working because of whatever reason and you've gone through the steps, by no means are we going to say you can't return back there, or somebody's going to say something really bad about you. Your mental health is definitely important to us, but we want to provide you with all of the different outlets that you can reach out to help make it work if possible, right? The facility does need you, but if it really isn't working for you, we don't want to put you in a place where you're putting yourself at risk. It's not worth it. So we have all of those different elements available to you. I think with that, it's a great thing to look at and kind of wrap us up as far as our trends go. But as you heard just Stephanie talk, she's going to talk a little bit more about self-care. Your mental health is critically important to us, and we want to make sure that you feel supported. So Stephanie, talk to us a little bit about that.
Yeah, so just speaking from experience, I was an ICU nurse. And so in the ICU with COVID and everything, I know it keeps being brought up, but it was a huge topic. I think before it hit, we were hearing about it in New York. Like, I live in Arkansas. And so we were kind of in that prep mode, that anticipatory, like what's going to happen. There was a lot of fear. The unit was kind of quiet, almost eerie. It was like waiting, the calm before the storm. And then once it hit, I honestly, I seen more deaths than I had ever anticipated seeing, with COVID, and also dealing with personal losses and stuff too in my own family. And I know a lot of nurses out there and healthcare professionals went through the same thing. And I think it's important. It's like, if you're sick, you go to the doctor to get well. If you are mentally sick, you want to also get help, because it's important people don't understand how much the mental impacts the physical and the rest of your life. And so I remember just coming home, and my family got to the point where they didn't even know how to help me because I was overwhelmed and sad and angry and didn't, I was scared every day that I was going to bring something home to my kids or my grandparents or family. And so I think a lot of people can relate to that feeling. And so I would say travel nursing has the benefit of, you take a short assignment and then you have, several weeks off in between to really rest and reset and to gain that compassion to be able to carry forward. And then, too, if you want to pick up a per diem job, the great thing about AMN is we do multiple solutions for work. So, not just travel assignments, but per diem through nurse finders. Pick up an assignment here or there and just kind of basically work at your own pace, so that you can take those days for self-care. Um, I can't say how important it is to take care of your mental health, and I know a lot of people are struggling, so I really encourage you to reach out. AMN, with our EAP program, they offer 8 free counseling sessions. So, sometimes it's nice just to be able to talk to somebody about what you're going through and the emotions you're feeling, just to kind of process it all.
Yeah. And on top of that, we have our clinical managers to help support you. And there's a lot of outlets for you to be able to feel supported entirely, not just like we talked about. That financial piece is huge, of course, but really the whole of you and what that means. So we want to be here for you, and we definitely can be. Um, I think just kind of wrapping us up here, I know my marketing team is going to get us some winners. I do have one final giveaway. So we have our most recent AMN Healthcare post. If you can jump onto Instagram and share that post to your story, tag AMN Healthcare. We will have a random winner. This package is actually really exciting to me. It's a home spa package, so it'll have all kinds of good stuff in there. You'll also get a steamer and a weighted blanket. So I know for any anxiety that you're feeling, I have a weighted blanket. I love it. I know some of the recruiters were talking about this earlier. Just having that moment to yourself is really critical. So jump on. The other thing I wanted to talk about was our Be Kind campaign. So we're really creating this movement that hopefully you will all start to feel, if you haven't already, to just give grace and be patient, and to just say thank you to all of our incredible healthcare professionals out there for everything that you do every single day. We know that being in a hospital can be a high stress environment from a patient perspective, from a clinician perspective, and we just want to give grace from our side to be able to really help support you and make you feel appreciated. I think we say this to our recruiters all the time, but our clinicians, all of you, probably very rarely get a thank you. So we just try to thank you in every way that we possibly can. I think if there's no more questions in the chat, Gypsy Nurse did post the COVID-19 site so that we can help you with all of that. So you have all of the up-to-date information, utilize it, reach out to your recruiters if you do have any questions. And then while I wait for the winners from our contest, if I don't get them, we will definitely reach out to you. Let me see. I think I do have a couple of quick questions here from Steve. Do you think there may be a post-pandemic endemic trend in which there may be more short contracts with a focus on time off in between assignments to help with mental health? Potentially. I mean, I definitely think that that's a possibility. I think the flexibility piece is what you see a lot more. And I think Robbie talked a bit about the flexibility element with travel nursing, and Stephanie hit on it too, that you have the opportunity to book, right now an 8 or 13-week contract and then take that time off in between to really just recenter yourself and whatever that might look like. Is Nurse Finders a 1099 or a taxed income? Great question, Ashley. I am not sure. Nancy will find out for you, and you can definitely ask her that question. Lots of great information. Shout out to the club staffing team. Ashley, yes, the EAP helps you with so many things, literally anything. I, back in the day, had a clinician who used the EAP to help her plan her wedding. So literally anything that you want, the EAP is there for. We do have a few minutes left, so I'll announce some of the winners. So our top 5, or our first 5 questions, we have Vanessa. Sorry. Let me see. Life Rerouted. Great job for the first 5 questions in the chat. I'm going to mess this name up, and I'm so sorry. Anakeme Stephanie Lynn, Ashley Meyer, and Crystal Watson. So great job, guys. You will receive those packages. And then I'm just waiting for the winners for my marketing team on anything else. Let's see, we've got some new comments. Katya, you're so welcome for the information. We do have a few minutes left. Also, if you have more questions, feel free to throw them in the chat. We will answer them. I think as I'm waiting for some winners to come through, I will just jump to all of you guys. So I'll start with Josh, you. What is something that you're looking forward to the most in 2022?
The one thing that I'm looking forward to the most is honestly probably the office opening back up and getting to see some familiar faces like once or twice a month, which is a good change of pace from just sitting in my office every day alone talking to everyone on the phone.
We're excited to be in person too a little bit for sure. And thank you. We just posted our Instagram winners into the chat. So please DM us if you see your name in the chat. Life Rerouted, you are so welcome. CC Cole, so welcome. Let's go, Steph. What are you looking forward to in 2022?
Honestly, a sense of normalcy a little bit. It's kind of nice. Like we have a bunch of concerts coming this summer, and I'm excited to get back to concerts and just getting outdoors. Honestly, I'm ready for warmer weather because it's really cold here in the South right now.
Love it. Yes. I think all of you on this call are ready for the warm weather. Nancy, what about you? What's exciting in 2022?
Same. I am in dire need of cold weather. Warm weather, no more cold. I'm really, really excited to start traveling a little bit more the rest of the year. There's a couple of vacations that I have planned, which I'm so excited for.
Yeah, I love it. Vacations, warm weather. I think everybody's ready for it. Robbie, last but not least, what are you looking forward to in 2022?
Gosh, I'm looking forward to my son, who will be here very shortly. So he'll complete the family. And normalizing our industry, right? Getting back to normal is what I'm looking forward to. But most importantly is watching nurses spread their wings. Most of the time you'll see it with like a newer traveler, but you could still get the well-seasoned traveler that wants to travel with you, that's ready to continuing to spread their wings. So that's what I'm looking most forward to.
I love it. It'll definitely be a great year, 2022, which I can't seem to say on this live to save my life. Just a couple of quick things here. So we'll DM the winners for the TikTok giveaway and the Instagram story share. We will reach out to tomorrow. So be on the lookout. You have plenty of time. Jump onto our AMN Healthcare or AMN Nurse and then share that to your story. I can't wrap this up with, of course, not saying thank you. Huge thank you to our partners at Gypsy Nurse who continue to bring us back and allow us the opportunity to share all of our information with this wonderful community. So thank you, Gypsy Nurse, for having us again. We value your partnership and we love being with you. I love seeing Rachel. I wish I could see Rachel like every month, but I guess on this live podcast we'll have to do. But thank you so much, Rachel, for bringing us back to all the Gypsy Nurse live team.
Oh, no problem. Here. And thank you guys so much for all of your knowledge. I know everybody loves it. You guys are so well versed and you just have so much compassion, you can tell, and just so much information that I know you have tons and tons of more information that you probably just want to like spit out. And, you only have like an hour to get it all out. So you guys always do so amazing.
Thanks. Well, we're so excited to come back anytime you want. And thanks for all the questions and the engagement today too.
Yeah,
I love it.
Well, if there's no more questions, we're going to go ahead and end it. But, the conversations don't have to stop here. You can message AMN on any of their platforms. They're newly on TikTok, so get on there and go see them. We're newly on TikTok too. We're getting used to it as well. So definitely going down that rabbit hole as well. You guys are, some of you nurses are super funny, and
they are. I am not that talented.
Yeah, me either, but I'm getting there. All right. Well, thank you everybody for joining us, and thank you again, AMN, for joining us.